the next speaker. He will talk about healthcare, cybercrime, and national security. He is a partner and director of cybersecurity services, the AbedGraham Group, and he's going to connect to us on a virtual mode, Dr. Saif Abed.
Thank you so much. So thank you very much for having me. As mentioned, I am a medical doctor by background, trained in London, England, but I've actually spent the past decade as a director of cybersecurity at the AbedGraham Group, where I lead a team of clinicians trying to solve the biggest challenges of healthcare cybercrime, and particularly in the context of national critical infrastructure and national security. And that's the journey I want to take you on today as my listeners and my viewers. I want to explore how cybercrime in healthcare has reached a stage where it is a national, if not a global crisis in and of itself. And to do that, I'm not going to regale you with facts and figures and statistics from cybercrime during the pandemic. I think everyone's seen and heard that. Instead, I want to take you on a journey of statements. Statements that I hope will lead us to a conclusion about what should happen next and where we're going to be in the next few years. So the most obvious statement that I'm going to make that you'll hear throughout this conference is we are clearly in the middle of a global public health emergency, a true crisis of epic proportions. However, this is not the first crisis of its kind. This is not going to be the last public health crisis of its kind. Hopefully, it will never be of the same scale in our lifetimes, but we will see local and regional public health crises. But the really important point is statement number 2, is that we are more dependent on digital solutions and infrastructure like never before, both in the delivery of day-to-day key clinical services, but now in the coordinated effort that is required across borders in order to tackle public health emergencies. And if you agree that we are now digitally dependent in our critical services, especially in healthcare like never before, then surely you will agree with my third statement. And that is any investment that is made in cybersecurity, be that people, processes, or technology, is actually an investment in patient safety. We're seeking to secure that digital infrastructure that we are so dependent on so that we can deliver our key clinical services at scale and to coordinate our responses across borders to these crises that we find ourselves right now. But conversely, if you look at the challenge that we face, the rise, the scope of cybercrime that has been targeting hospitals, biomedical institutions, government agencies across the world, and especially in the most digitized economies, then you have to agree that the scale of disruption is now at the very least at national level proportions when you look at how healthcare systems are being disrupted, if not at a global security level. And so this begs the question, how did we get here? What has come together to create such a combustible situation? And this is something that I've coined that I call the healthcare maturity paradox. And frankly, it can be applied to any industry, but it fits particularly well when it comes to healthcare. You have to see that over the last 30 years, we've been in a situation of creating incentives to digitize healthcare. Through legislation, regulation, and policy making, effectively what we've sought to do initially is to move healthcare away from paper-based workflows to digital workflows, literally just replicating what we did on paper into the digital world. As we started to succeed in doing that, we've started to introduce more sophisticated technologies in order to improve efficiencies, whether that's moving towards cloud-based systems or using, for example, machine learning to support and advance clinical decision-making. We are currently in the midst of the boom of digital maturity. We are nowhere near the plateau yet. But this is the interesting point. As digital maturity goes through this exponential rise, certainly driven by the pandemic in significant part now, we have not seen an equal investment and advancement in security maturity. And it is that gap between digital maturity and security maturity that I call the attacker's arbitrage that makes healthcare such an attractive target. You have a sector that delivers critical, urgent services that is increasingly highly digitally dependent, but which is easy to compromise, not just compromise, but compromise at scale. So all you need is the right incentive mechanism on the part of the threat actor at that point, be it financial, be it geopolitical, to light this combustible situation in terms of where we now find ourselves. And really, we continue to advance in this landscape. The key phrase here for why healthcare is where it is that digital maturity does not equal security maturity. In fact, it exacerbates risk and security problems just purely in a theoretical academic sense if you do not balance the two parts of this equation. And what's happening in healthcare is that this disparity between digital and security maturity is continuing to advance. It is getting wider and wider. It is happening at scale in at least every developed economy, but also developing economies as they seek to digitize, partly in response to the pandemic. And there are some key exacerbating factors that we have to take note of in this. First of all, step one, why is the gap getting wider and wider? Well, frankly, to put it simply, there are more networked endpoints and internet-facing endpoints, or just a degree of separation away, than never before. We are in uncharted territory, not just in terms of how many vulnerable traditional IT endpoints we have, but we have the quote-unquote smartification of devices that were never network connected and certainly not internet-facing, suddenly being made so. We have OT technologies being used for their very beneficial sensory capabilities for analytics and adjustments, but these are very often highly unsecured endpoints in and of themselves. So the surface area of vulnerability and for threats to be executed is just getting larger and larger and larger. And all industries are facing this, but there's been an exponential rise in this when you factor in IoT, mobility, telehealth, and remote working. But let's take this up a level. Let's go from the organizational level to the regional level and beyond. One of the key fundamental elements of successful healthcare delivery is interoperability. Data and system interoperability. We need to be able to share clinical data between hospitals, between clinics, with academic research institutions, with pharmaceutical companies, biomed, public health agencies, government agencies. We've been driving to achieve this for a long time in healthcare, and we're slowly getting there. But a lot of the key standards or protocols used for interoperability are provably highly unsecured. HL7 version 2, the most commonly used in terms of legacy, highly insecure, provably so, shown in the lab, shown by clinicians working in security. Even the newer protocols are, prone to vulnerabilities like anything else and misconfiguration. And so not only do we have a much larger ecosystem of endpoints, we have more mechanisms than ever before to spread an attack and scale it across institutions, across regions, across geographies. This is really devastating as a concern when you think about it at national and global security levels. And then the point that was already discussed at length, we also have these unsecure supply chains, and that occurs in a multitude of ways, actually. We have more companies than ever before seeking to provide products and services into healthcare. From the smallest startups to the largest technology giants, there are pivots happening into healthcare. And as a security leader in healthcare, you must accept the challenge that you are being pushed to digitize, secure efficiencies, and enhance capabilities, but you're not being pushed from a security maturity perspective. This makes it very difficult to manage your supply chain that you now have to interact with that's getting larger and larger. Factor in outsourcing of elements of responsibilities through managed services. And we've already seen, in the last few weeks, how tremendously disruptive that could be at a global scale. The key point here is a lot of these things are beneficial developments, but from a security and risk perspective, because of that digital versus security maturity dynamic, they are leaving healthcare susceptible to the greatest disruption at the greatest possible scale. So what can we do about it? I mean, the easy answer that I could give is the same line you'll hear over and over again from many people who talk about the solution. We need greater collaboration between private and public sector, greater collaboration between law enforcement, intelligence agencies, and healthcare agencies. We need greater engagement at the executive management level of companies. But the key challenge in all of this, and as I'm about to wrap up my final point, the key point in all of this, you cannot achieve any of that if we are not using a common language set. At the end of the day, most of the people in the healthcare ecosystem are not security experts. They're not interested in SMB vulnerabilities or remote code execution or your CVEID or your CVSS score. What they're interested in is outcomes. And that's been my work, my organization, my team's work, has been to look at this fundamental challenge. How do we move forward to a common language set between people from different stakeholder groups who are essential to improving the risk profile of healthcare at the highest and most scalable levels? How do we go from vulnerability and threat intelligence that's very difficult to interpret to meaningful metrics about patient safety and the potential impact on clinical services? If we can solve that conundrum, we'll be in a much better position. But until we do, I hope you'll agree with me, we're now tackling a challenge that's reached national and global proportions as a problem. Thank you very much. Happy to take any questions. Please feel free to email me if you find any of this of interest. So thank you. Back over to you.